What up, fellas? It's Ty. Welcome back to the channel where we discuss all things prostate and prostate cancer related. If you're new here, welcome. I'm a prostate cancer survivor. I've taken it upon myself to share tips and things to know for fellas who are just finding out that they have prostate cancer, and I want to share some of the first-person knowledge that I have. If you've been here for a while or you've liked and subscribed, I appreciate you, and let's get into it. So today I want to talk to you about something that's very important. I got about a handful of people that I know, and whenever I find out somebody has had prostate cancer, I always, if I have the ability to speak with them, I'll speak with them about what their circumstance was and how their outcomes came out, because I'm always curious to see the scope of things that could occur. So about a handful of those people that I've met over the last year and plus that I've had prostate cancer have had setbacks as they finished the radical prostatectomy and left the hospital. And those setbacks were due to the catheter getting infected. So once you finish the radical prostatectomy, you will wake up and there'll be a tube in your penis attached to a bag. You never get used to that, fellas. And that is a difficult look. I can tell you, I looked down, I was like, yo, and it just felt funny around the tip of my penis, like right where the tube went in, it felt funny. So when I was in there, they hang it on the bed and they tell you to keep it below your bladder. And so when I was in the hospital, mine got backed up. It was crazy. I felt like I had to pee, and I kept looking at the tube, right? Because it's clear just to see how much pee was coming through. I mean, that's just what I was doing. And I was like, look, I got to go to the restroom. Nothing was coming out. And I had like this discomfort. And so they had to come in and flush it. And as soon as the nurse flushed it, I was like, I felt a little better. And I was like, oh, we can't do this at home. Now, for me, I have an emergency RN as a wife. So I, some of these things sound like medical terms and some of the other stuff, but I actually had someone telling me what it is I needed to do. So if you hear me and I sound like I'm giving you medical advice, that's all I'm doing. She is a medical professional that shared this information with me. I did it. I'm going to share it with you. So you can do what it is you want with this information. Some of it might work for you. Some of it may not. Take all of it, part of it, half of it, I don't. So, get back to your house. I got a recliner. I sat in the recliner, kept that bag below it. Made sure that tube wasn't all snaked around, making sure that it was able to drain through. That was the first thing. The second thing was making sure that I kept the thing clean and myself. So I got in the shower every day, and after that there was this task of making sure that the penis, where the tube goes into the penis, was clean. I think that sometimes people forget that piece. They're looking at everything else and they forget, but that is the piece you need to make clean. I don't know why. I would think that the whole thing would be dirty or something, but that was where she concentrated. And mine did not get infected. It did back up at home. Again, that flush is important. Now, if your significant other person is not an RN, then, I can't sit here and say, oh, but I remember having that discomfort in the hospital and having it again. And I remember that she was able to assist, but they did tell me how to do it. I just didn't have to. But you need to make sure you pay attention. So when you are getting those exit instructions from the nurse, turn your phone on. Record the information. Make something so you can refer to it. They're talking really fast, and then you do this and this and this. Nope, I'm recording all of this. Because you're in another circumstance, you're in another world. You're not thinking about any of this stuff, and all of this stuff could be difficult for you. So that catheter getting infected could bring on a lot more incontinence. It could bring on a longer period of erectile dysfunction. You don't want none of that. You want to get that thing out. I think it's a week or 2 weeks. You want to get that thing out. And so it starts to be uncomfortable. So laying down is also a thing. You got to keep that thing below your bladder. I slept in the recliner until I almost had it. It was 2 weeks, but I slept in the recliner just to make sure I made sure that thing was flowing appropriately. I drank a lot of water, and I actually drink all water because I didn't want anything in there. That was it. So that's one. There's this big catheter bag. You dump it. You go to the bathroom. You dump it, and you go back and you hang it up. The catheter. Now, it's my understanding. I kept thinking I was gonna pull this thing out. I did. I thought it was in there just like this in the penis, and all of a sudden, like if it got pulled, it was gonna pull out. No, I remember asking the nurse. I said, "How are you holding that in there? There's something about a balloon or something that's on the other end." And then when they're taking it out, they like take the air out of the balloon, and then it's just like, yoop, they just yank that thing out. Yes, they just yank it out. But I'm a little ahead of myself. So there's also a bag that they're going to give you that's you can go around and do some other stuff bag that you don't have to hold. It's a leg bag. It goes on your leg. I was excited when I saw that. I thought that I was going to wear that all day. I thought that I was going to be wearing that around. And I was like, look, I'm never going to use this big one. Man, I don't know about everyone, but my leg bag filled out quick. Every time I was going somewhere trying to do something, my leg bag was 100% filled up quick. So I was like, this is not something that I'm going to be able to do long term. But if I was going somewhere and trying to do something, I throw on some sweatpants, put on the leg bag, and go ahead about my business. Again, once you get through all of this and you get to the end and they need to take the catheter out, you go. The nurse will go in, and then all of a sudden, it's just kind of a yank out. It's almost like I was sitting there, and all of a sudden, it was like, sloop. And I was like, oh, and I thought, I thought my penis was with it. It felt like, I was like, hey, you just gonna yank it out? Yep. Take a deep breath, shoop, pull that thing out. Right after that, I peed funny for a little while, I think. Yeah, I was like, it wasn't but the stream, everything got better, and you're able to kind of go from there. You do not want this backed up, because if you do, you're going to end up in the hospital with an IV drip. I know that because those people told me that that's what happened with them. They had to go in there and get an antibiotic. You do not want to do that. Once you get out of the hospital and you had the surgery and you're trying to recover, you're trying to heal, you already missed work, you're on short-term disability if you have that, or you're trying to get back to work and get cleared, the last thing you want is an infection. So make sure you take care of the catheter, fellas. Make sure you make a video of the nurse telling you how to take care of the catheter. And if you have any questions about anything with your care, you can do just like I did again and take a video of everything they're saying to you so that you can go research whatever it is you didn't understand. And then if those things that you did understand that you don't remember, you'll have a point of reference. As always, fellas, peace and blessings.